So Dan is now going to talk to you about new initiatives and support activities, right?
Okay, so hi. I'm Diana, I'm the nurse for the Pagets Association. We are the only UK charity to focus solely on Paget's disease of bone, and we're here celebrating this year 45 years of the Pagets Association. And it was because of a man called Alf who had Paget's disease in the 1970s that were based in Manchester, and his wife, Anne Stansfield, strove to help not only him but other people who'd been diagnosed with Paget's disease in the 1970s when not so much was known about it as it is now. So from a front room in Manchester, Anne started to set up this charity and help other people. And in 1973, the charity was formed. So that's how come we're here today. You've met quite a few of the trustees today. And we have three members of staff who are all here today. Sue, you will have met when you came in, Rebecca, who's quite new, and myself. And our sole job, our sole aim is to support people with Paget's disease through various means. And I'm just going to go through some of our new initiatives and also some of our recent achievements. So you may be aware of some of the things that we are doing to support people. We provide a lot of information, newsletters, booklets, etc. We're also raising awareness in various ways, and we're funding quality research. So I'm going to see through my talk if I can add to this slide. So these are the three research studies that we've funded very recently. So looking at pain, you'll all be pleased to hear. Obviously a hot topic anyway, but certainly a hot topic in Paget's disease. We're also looking, we've also funded a study into the genetics of Paget's disease, and also some research at Norton Priory in Runcorn in Cheshire, where we're looking at medieval forms of Paget's disease and how it has changed between then and now, and also looking at the soil environment and things like that as to, possibly what even could trigger Paget's disease. So there's an awful lot of interesting research going on around Runcorn at the moment. We've also awarded student research bursaries over the last few years, and that is something that is just being offered again. So if you know any students who are interested in £6,000 to research Paget's disease, that's what we're offering. And we're also offering grants again to universities to fund research into Paget's disease. So all the information's on our website. You've heard about the clinical guideline that's been developed in conjunction with the International Osteoporosis Foundation and also the European Calcified Tissue Society. So that's going to be published fairly soon, and we've been working on that for some time, so we're pleased to now have that at a point where it can be published. And we have also extended our Centre of Excellence Award this year. So we've added 2 more centres. We've now got 12 centres in the UK who have proven excellence in care and research. I've been a few places in the country this year. Liverpool and Southampton were the 2 new centres of excellence, so we've been there raising awareness of Paget's disease. I've also been to Glasgow, Oxford and Birmingham just last week to talk to GPs, so I've been all over the place just trying to raise awareness of Paget's disease and let people know about the Pagets Association. I'm going to be in Birmingham again at the end of the year for a 3-day National Osteoporosis Conference, and that will mean that I'll get to talk to lots of professionals, lots of radiographers, nurses, doctors, consultants about Paget's disease. So we're all over the place trying to raise awareness of the condition for you. There are some videos on YouTube, also on our website as well. So if you've not seen those, I added some new ones last week. So if you want to look at some of our videos from the last patient information day, we do still have some DVDs if you prefer that medium. But if you want to look at them on YouTube, get a cup of coffee, sit down, a few biscuits, you'll be there a while. But there are some really good talks from the experts on YouTube and also you can access them from our website as well. If you have any difficulties with any of that, just get in touch. So what are we doing that's new then? We're quite a small charity, but we sit around the table trying to come up with some big ideas every year. You've heard about the guideline. The thing that we're doing is putting some money behind that to make sure that it's open access. So the doctor, the GP that's sitting in his consultant room, the consultant that needs a bit more information, they're going to be able to get access to the full document when they've got time to read it, of course, but they will be able to get the full document without having to pay for subscriptions to a journal or anything. We're going to produce a summary for you as well. I'm also in the process of revising our facts book, and that's obviously had to wait for the guidelines to be finalised. So I'm on with that. At the moment it's gone out to patients, a patient focus group, just to comment on it, and then there will be some further amendments, and then it will be published once the guideline itself has been published. When we went to Southampton to talk to the patients at the Centre of Excellence there, Dr. Beth Curtis gave a presentation. She and her colleagues had been looking at clinic letters and how good or bad the information in the clinic letter was. So basically the communication between the specialist and the GP. It's the main method of communicating, the ongoing treatment plan and how the patient's doing. So they audited the quality against various standards, and the amount of information that was communicated was quite variable. The actual treatment plan was only recorded in 98% of letters. Was recorded in 98% of letters, which is good. But there were various other aspects that weren't recorded quite so well. So what she decided was that it would be a good idea if patients could have something else, some other way of showing the doctor what's going on with their condition. And she suggested something called a Pagets passport. And as a charity, we said, well, we can do that for you. We can put some money behind it. We can produce it. We can get it printed. We'll give it to you. It's not a problem. But then, of course, what about the rest of the country? So in your packs, you will have a Pagets passport, literally hot off the press on Tuesday. Touch and go whether we came with them today, but you now have one. It's pocket-sized, it's a summary, it's basic, but basically it means that the information that goes in there can be taken to any of your appointments. So if you're going to see the orthotic department, or you're going for physiotherapy, maybe they've heard of Paget's disease, maybe they haven't. But you can take that, it's got a little explanation in as to what it is. It gives key dates as well, so if you're at your doctor's and he's not quite sure when you last had treatment, to save him looking it all up, you can show him the date and then he can find it easily in your NHS record. It's just a handy little thing to have around and to carry with you if you're going to Newcastle for the day. When your GP is somewhere else, you happen to need a doctor, you've got the information to hand with you, you don't have to remember the dates, you don't have to remember what your last alkaline phosphatase test was, it's there with you. It might be difficult to get your consultant to fill this in. He's a very busy guy or lady, but we're hoping that you can persuade your nurse, your doctor, your GP to fill it in for you or with you. But if not, certainly try and get the information as accurate as possible so that you do have an ongoing assessment as what's going on with your particular condition. And you've heard already that we're going to have our very first Pagets Awareness Day. So this is taking place on the 11th of January. And this is this particular day because it is the 205th anniversary of the birth of Sir James Paget. We are in the planning process at the moment, but we're thinking we may end up in Great Yarmouth, which is where Sir James Paget is from. You're going to hear more about that this afternoon. But we may do something in Great Yarmouth on the day, we're not quite sure yet. Why are we doing it? Because we all know if you've got Paget's disease, you know that not a lot of people around you has got a clue what it's about. So we're doing it to raise awareness, And we know that the people with Paget's disease that are out there are just the tip of the iceberg, that are the ones that are being diagnosed. As few as 7% with X-ray evidence of Paget's disease. In other words, it's been seen on an X-ray, but they've never actually come to medical attention. Nobody's assessed their Paget's disease. So it was an incidental finding. So there's a lot of people out there that are walking around with Paget's disease that really don't know about it, or maybe they've been told about it, but nobody's ever assessed it, done anything about it, looked at it. So that's why we want to help, we want to raise awareness. And to help you do that, I want you to look at Sid. Think about Sid. He's the patient that's got Paget's disease. It was diagnosed very late. He's got complications. He's in a wheelchair. It is one of the most nasty cases of Paget's disease, shall we say, that you can think of. We want you to think of him on Paget's Day and give him some support. Support the Awareness Day. There's various ways you can do that. For instance, putting up a poster. You can inform someone, tell someone about Paget's disease, tell them what it's about, what it means to you, and do something. So some ideas on our website. We're going to we've given you a poster today, so if you can take it to your GP surgery, your health centre, your library, if you can't get out, just put it on your front door. We want to raise awareness of Paget's disease, what we're doing, and direct people to our website where there's lots of information about it. We're asking people to wear blue and green. You've probably gathered that. Thank you, Roger. So the guys are going around taking photographs today, so make sure they capture you in your blue and green, because we really want to use the colours of the Pagets Association's logo to get our message across. There's things on our website you can buy from our shop. You can enter our photograph competition that we're having, and all we want you to do is take a photograph of something blue and green. There is a prize, so have a look at that on the website. If you want to knit something and crochet something, you could be sponsored to knit. I've knit a scarf, it's at the back, it's not very good, but it's there. Sue's making an octopus. Yeah, you can ask her about that later and how many legs it's currently got. But anything you can do to raise awareness, take a picture, put it on social media, send it in, we'll use it in our newsletter, just help us raise awareness of Paget's disease. And join the conversation on social media if you can. So these are the things that we've added to that slide I showed earlier. And we want to keep on adding. We are a charity that doesn't stand still, and we won't rest. I won't rest until everybody with Paget's disease has been diagnosed and gets some help. When you get your newsletter around about early November, end of October, it's very unusual to find that anything falls out of our newsletter. We don't have any adverts in there. We don't have any bits that drop out that you have to throw in the bin. But this time there's going to be a poster. We know you've got one today. You're going to get another one with a newsletter, so please find somewhere to put it. We'd be grateful. And of course, anything else that's happening, information about the new guidelines, etc., it'll be in the newsletter. So make sure you're signed up as a member and you keep your membership so that you can get the latest information. At the request of Professor Russell, I've included this slide about a professional meeting next year. This is for professionals taking place in Sheffield in July. And remember that next year, bisphosphonates are 50 years old. And they have gone from strength to strength, developing better and better treatments over the years. So next year, I just ask that you try and use your passport, read the summary of the guideline when we put it out there, ask for a new facts book because that will be very helpful. If you want a new one for your GP as well, that's fine. And support the Awareness Day. And if you like, tell us what you're doing. I was talking to a gentleman this morning who wants us to advertise a walk that he's going to do in our newsletter and get sponsors. We'll do that. It's not a problem. So tell us what you're doing. If we can help promote any fundraising that you're doing, we will. So thank you for listening. That's all I've got to say.